Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterna with Meridian Community Care, here today with Renee Amacker, who is coordinating all of our marketing, development, communication programs here at Meridian. And one of the things that we've been doing lately is going out and doing a lot of focus groups and trying to get an understanding of all the different groups. What are some of the groups that we're going to be talking to?
You know, we found kind of 5 areas we wanted to focus our attention on: law enforcement, business owners, healthcare professionals, parents, and then schools.
Well, and I think what we have found out, and I think we kind of thought this going in, but it really struck me when we were talking to a local police chief who said, talked about how much the drug and the addiction problem is affecting their job. And about 80 to 85% of the calls that they get on a regular basis are addiction related. And he said, we're not going to be able to arrest our way out of this problem. And I guess that's when we started having conversations about recognizing that this whole issue of addiction really affects every aspect of our life. And then we kind of saying that, in a way, we all have an addiction problem.
Right, and we actually spent some time with parents recently, and one of the mothers told us that, I talked to my kids about drugs and alcohol, but I didn't know what was out there, all the extra stuff like K2, spice, that kind of stuff. She wasn't aware of even what was out there to talk to her kids about.
Well, and I think what we have to understand about schools is we all try to protect our kids, and even if we're doing a wonderful job with our kids, we have to recognize that once they go to these schools, the amount of drug and alcohol activity that's going on in our local schools, and it's every school system, the amount of bullying, some of those other issues that are happening in school, that we want to make sure that we're protecting our kids out there. Right. And so the more prevention kind of work that we can do in the schools, the better. And we also know that a lot of the problems with addiction that are in the schools are affecting our kids' ability to learn. It's affecting their truancy rates and their ability to graduate. And, it's just the beginning of a lot of problems in our school system.
And another big area that it affects is our businesses. Healthcare costs. Business owners aren't able to hire people because they can't pass drug tests. That's a big problem that we're finding in our community, too.
We do hear that a lot. And I think we also want businesses to recognize that if you have employees that work for you who are struggling with either an addiction or even abusing drugs, that they're more likely to get involved in workplace accidents. So that's going to affect your workers' comp claims. They're also probably more likely to use the emergency rooms, which are going to make your health care costs go up. They're probably going to be less productive. They're probably going to call off sick more often, which means you're calling in other people to come and replace them, paying overtime. So really, if someone is working for you that has an untreated addiction, it really is costing you a lot of money.
It is, and we've even talked with some actual healthcare professionals, dentists, doctors, that kind of stuff, and seeing what they see on an everyday level when it comes to their, other doctors that they know of prescribing opioids for toothaches and that kind of stuff. So we're really kind of working with them to kind of figure out what we can do in our community to address those issues with the healthcare professionals.
So we know that untreated addiction has a really negative effect on crime rates in our community. It increases our healthcare costs. It makes it more difficult for us to have a strong economic recovery. We know that it's affecting schools, and we know that it's affecting our families. And so what you'll be hearing a lot of us talking about over the next few months or the next few years is how we have to all come together if we are going to address the addiction problem in our community, because we really all do have an addiction problem, and we're only going to be able to solve that problem if we work together.
And we actually have a page on our website that you can go to that lays out all 5 categories and the stats and ways to get involved too.
Sounds great. Thank you, Renee.
You're welcome.
For more information, go to our website, meridiancommunitycare.org.